everybody, it's Matt and Dyan. It is Friday the 18th of April, 5:39 p.m. Just let me give you a downer try. Thanks, Dyan. Let's get you into bed properly because unfortunately, stick around, I feel like we're going to have some neurological activity going on. Dyan was just feeling a little bit unwell very suddenly. She has had a bath. She has said that she is in a lot of pain. So we've just brought the night medications into play. So she's had Panadol Osteo. She's had a gabapentin 300 milligrams, which is part of her nighttime routine. She has also had a sodium valproate to make sure the levels for that are up at the tablet form, and the ondansetron 2 milligrams. It's alright, sweet pea. We get through whatever we need. Fingers crossed, this will be something. It won't be something. I'm going to give you some medicinal CBD too, which will help with your nausea. The ondansetron 4 milligrams has just been applied. Oh, hello Maxie. Max is on the ground down here. If we can get in front of things with seizures, with medications, then it can reduce the intensity, the duration, and obviously the frequency of what's actually occurring. And we can obviously hopefully get in front of things like status epilepticus, the rolling type seizures. So 0.5 ml of medicinal CBD THC in a 10 to 10 ratio has just been provided. Now pulse oximeter is on, but I need to put the elastic on there, sorry. And I'll just get the Bluetooth up and going to make sure that that's reading, which we can see it is on the device. Let's get this up and going. Okay, pulse ox 696. For oxygen, pulse is 63. Controls up the way. Happy Good Friday. It is Good Friday here in Perth, Western Australia. Your body's not happy?
It's not happy to Jesus rises.
No. And that's not far away. We've got Sunday to do. Dyan has just started eating some veggie chips. These are a plant-based, very low calorie, but also something that she can consume gluten-free, which is more to the point. Sorry Max, I need that spot. Come on little man. Appears like we're getting something on that. It's 94 for the oxygen, 55 for the heart rate, which is dropping down. Good boy, Maxie. We've got Willow over here as well. He's keeping a close eye on things as well as he possibly can, aren't you, buddy? Max has just jumped up to say hello. Dyan's movements are slowing down. She's just had a sudden urge to need to go to the toilet, which is where we've just enabled her to do. Her walking to the toilet was very, very difficult. Okay, so we've got a 37.3 degrees. Now, it's not a febrile temperature. 37.5 and above is where we get majorly concerned, but it is actually heightened for her. Room temp is 24.9. Not too bad, but let's actually just bring that down a tad. Trying to get to square at 24. First of the ticks, 5:42. Now afternoons and evenings are the worst case for where we expect to see things like this. As the day wears on, Dyan's exhaustion levels peak, her pain levels also increase, her efficacy of the medications reduce, and particularly in a timed way. Just going to relax, take your blood pressure. And what I mean by a timed way, there is issues when different times of the day started irregularly, and Dyan started very early this morning with a 5 o'clock start. That's when she woke, so her sleep quality didn't actually get all the way through. Okay, I'll just turn that down a bit, okay? So you're not going to feel that. We're going to be careful that it doesn't get too cold so that we don't get ticking actually occurring. Oxygen starts at 95, but they've been flapping around. Heart rate's at 51, so we may get some alerts. Bringing the audible alerts into play. So the ondansetron normally is a good indication when things are not going well, because nausea is a pre-ictal sign for Dyan. Okay, blood pressure. We've got 103/64, pulse is at 52. Dyan's baseline is actually quite low. She's actually normally 85/60. Let's just bring that up for you. Max is hunting around at the moment, doing all the things that he shouldn't be doing over there. Maximus, hop out of there, please. Can't focus on you at the same time.
He's trying to be a Disney guy.
He's trying to be a Disney character, yes. He is with your Disney animated series. Let me know if you have any chest pain. I'm prompting Dyan as things go along, mainly because with autism and interoception particularly, Dyan cannot always know the internal states of pain and where she's at with things. So that is a challenge, and we have to actually look at what's going on around that. Indicators such as body language will help me. You know, for example, has she got a furrowed brow? Is she irritable and showing signs of irritability? That's all right, we'll sort those out later. None of them are breakable. Max, you're not helping, dude. Just getting some midazolam ready.
Ow.
Now, like I said, there are a lot of indicators for Dyan which help us to know, is she likely to go into neurological. Dyan's been clearly showing a lot of word finding difficulties, slurring, speech difficulties.
He's destroying my Disney.
He's being a little rat bag at the moment. He's a distractor.
Not right. It's not your toy. You've got your toys, Max.
Getting the med oxygen concentrator ready in case I need that if levels drop out. .4 room temperature, a lot of ticks going on. He's playing with these. You have demolished Mum's display case of her Disney animators. You are a little rat bag. She's not going to be happy with you, dude. Oxygen stats are good at the moment, 98. Heart rate is at 55. It's currently 5:48. 21 degrees outside, 24.3 degrees inside.
Am I going to be okay?
I'm hoping you are. I'm hoping that we've got medications in front of you. You're very warm to touch.
No, I feel flighty,
You feel flighty.
No, like I'm going to faint.
Okay, you are showing some signs of syncope and passing out. Just relax for the moment and keep an eye on you. Dyan's had a lot of leg pain today, so we've had to do quite a bit of work on massaging her legs. That's why we've also used the Windsor walk-in bar for her today for the first time. showing some signs of syncope at the moment, passing out. Both eyes are slightly open by about 5 mils equal. Blethrosism and oral mandibular dystonia in the face. She's got segmented dystonia in the face happening. You can see the right 3 fingers on the left hand have curled over into a dystonic posture with flexion forward of that left wrist. So she's got a focal dystonia of the left. She's got an inversion of the right foot currently going on as well. So it's out of its normal posture, so there's a focal dystonia occurring around that foot. So we've got multifocal dystonia positions happening. You can see the oral mandibular because the mouth is actually working at the moment. So the jaw muscles, which is the mandible of the jaw. Blethrosism is where the eyes and the eyebrows are engaging. Doing really well, both. Hopefully this won't last long. The medications that are given you, which is the muscle relaxant, will help you massively. Oxygen stats at 95, heart rate is at 62. If you're new to the channel, Dyan has 22q, 11.2 deletion syndrome. It's a chromosomal disorder. So genetically, Dyan is missing a microdeletion of the long arm of the 22nd chromosome. That's causing her to miss about 3 million DNA building blocks. All that equates to around about 40 to 50 genes effectively missing. That affects every cell structure in her body, and clinically that presents with about 185 clinical different symptoms. There's a causation, it's an umbrella term because it's a genetic condition. Getting tonic-clonic seizures at the moment in a mild, subdued manner. You can see the flexation around the upper torso, shoulders and the neck, keeping on oxygen, which is at 94%. Heart rate is 55. About 60-65% of patients with 22q will have seizures, seizure-like activity, neurological activity, also leading into things like Parkinsonian disorder. Dyan also has the dystonia, which is a movement disorder. She's got calcification bilaterally on the basal ganglia, and that's a causation of blocking the messaging to the facial nerves and muscles. That's causing things like the fixed position, the flexation or the fibrillation that occurs in those muscle points. Dystonia can be a deteriorating condition and normally starts in the face. It may be in the jaw first or a mandible, then maybe in the eyes, blethrosism. It can progress further. So Dyan's had generalized dystonia, focalized dystonia, multifocalized dystonia. She's getting it in the mouth at the moment. Hey, sweetie, I'm just here, okay? No, you can hear me, it's all right. These movements are involuntary, out of her control. A lot of Dyan's autonomous systems don't work. Things like the dystonia, the POTS, postural orthotachycardia syndrome. So she has orthostatic intolerance, that's why her blood pressure drops out and goes so high as well in between. Getting a lot of facial, cranial, segmented dystonia. Some of these positions can actually hurt, in particular if the jaw is engaged with the transmandibular joint. That can actually cause subluxations, and she subluxes or dislocates both. We're going into a tonic-clonic seizure, 552. It's all right. Come on. It's okay, we can get that out of my way. Keep you on that side, just want to see how you're going. Get down. I've got your hair. I'm hoping the medications, the ASMs, anti-seizure medications that we've already given Dyan will jump in quickly. I'm getting secondary tonic-clonic seizures, 5:53 p.m. Extension of the right arm. She's in a figure 4 postural position, left crawl. Contractions coming through the neck. Still got dystonic. Contractions through the thoracic, lower leg, upper leg. So oxygen stats are great, 96, heart rate 65. That's flapping upwards for her because it's so energizing doing this activity. And Syncope passing out. Good going. Right. Just keep an eye on airway. Aspiration, where swallowing fluid down into the lungs can occur during this. This is why we just maintain and carefully keep an eye on airway position and the ability for the fluids to go out, particularly the dystonia, which can affect muscles around the back, around the chest, the pectoralis, the diaphragm, these muscles that are engaged and used in breathing, the esophagus used in swallowing actions. So sometimes that can affect and obviously interrupt her breathing cycle. So that's good, 96, heart rate's at 51. Alarms may go off if it drops down at 50. We've got thresholds set on oxygen and heart rate. Thresholds for heart rate is at 50 and at a high point of 120. She'll exceed and reach both of those points during these activities quite commonly. Oxygen threshold alert is set at 90. So if she goes below 90, I'll apply supplemental oxygen just to make sure that she's able to breathe okay. She's in the syncope. It's currently 5:55. Doing really well, boo. Now 22q, 11.2 deletion syndrome, still quite a modern term in regards to genetic medicine. Previously it was known as things such as autosomal dominant Orpitz or KT22, cardiofacial syndrome, truncal anomaly face syndrome, DeGeorge is probably one of the more common ones, Saragtha syndrome, Spritzen syndrome, and video or velocardiofacial syndrome. So there's a whole lot of names previously it used to be utilised. Really well. Oxygen stats are at 95, heart rate's at 56. I'm right here. It's okay. Keeping an eye on her. Unfortunately, with the deletion that occurs with 22q, genes such as TBX1 and also the CRKL gene are both commonly missing, and a lot of those will affect and relate to seizures and seizure activity. It's a very variable clinical phenotype and it ranges from mild to severe depending on the patient. A lot of children who are born with it may not actually through vitro pass and actually be born. Some will pass in the first 3 months to 2 years of their life. There's not a lot of longitudinal studies done because not obviously all patients reach full-term age. That's why the average age is 41.5 years. So it is a concerning condition. Out of those 185 clinical symptoms, a lot of it's related to cardiovascular is probably one of the main concerns and points of death mortality in these patient groups. Getting some jaw thrusting and some lower mandible action at the moment. Really well. Oxygen stats are great, 97, heart rate's at 54. Unfortunately, a lot of healthcare professionals are totally unaware of this genetic condition and may never come across a patient in their entire practice life, and they certainly probably wouldn't have heard about it in doctor's school. It's okay, I'm right here, baby girl. You want your pillow? No worries at all. It's all right. It's all right. I'll come around. It's okay. Current time's 5:58. This is over here. Yes, you roll. Unfortunately, the longitudinal studies, most reports involve individuals only up to their early or mid 30s. Dyan is actually 50 years of age. Obviously, so the severe symptoms of 22q can lead to a shortened life expectancy without treatment and management. One of the difficulties that we face is the fact that we do not have a specialist for adults for 22q in Perth, or let alone Australia. There are 2 clinics for children, one at the Perth Children's Hospital, other in Queensland, but they only manage and treat children. Fortunately, once you become an adult, that surpasses, and there is no continuity of care for those children as well. We are looking towards getting an adult clinic, hopefully in the next 5 to 10 years, but for the moment, we're reliant on the international clinical guidelines and educating and advocating for the condition to the specialist. Diane's got about 22, 23 different specialists, and she's been centralised to a major Perth hospital for her condition, under cardiology, respiratory, sleep, obviously neurology, gastroenterology, urology, infectious diseases, pain management, rheumatology, orthopedics, vascular. There are just so many different specialists that have to touch base. Initial testing and monitoring. You're seeing a lot of left jaw thrusting and the tongue's poking out and the jaw coming through this area here. You're still seeing that both eyes are in that position. So we've still got the facial segmented cranial dystonia at the moment. Tonic-clonic seizures seem to have settled. The feet action seems quite good at this point. Hand has got some mild distortion, so we've got left focalized dystonia. You can see this hand tuck position. We can't release those. Right hand is fine, and still the segmented cranial. We're not seeing any generalized dystonia or thrashing of the legs today, which is great. But we have had a couple of milder 2 or 3 tonic-clonic seizures. Hey, it's okay, doing really well. Heart rate's 95, stable. Sorry, 58 for heart rate, and oxygen is 95. Adults with 22q, 11.2 require follow-up, regardless of the age of diagnosis. In virtually all cases, later onset conditions emerge that require clinical attention. Knowledge about the high variability in number and severity of manifestations of 22q related risks is essential. So periodic assessments are required across all the disciplines for the condition. First of the yawns, 601. I say first of the yawns because we look for the yawns as an early indicator of a termination of tonic-clonic seizures naturally without intervention. I haven't had to apply heavier duty ASMs, anti-seizure medications, so she seems to be coming around. Once I've seen another 2 tonic deep yawns, then I'll say her body's relaxed enough that we won't be doing any more tonic-clonic. So it'll still probably be some post-seizure tics, maybe still some legacy dystonia occur, but she's going to start to feel some pain spots. Indications early at the moment are around the neck, cervical. She obviously has CCI, cranial cervical instability. Right hand side. Okay. Let's have a look. How's your jaw? C4, C5. It's okay. Yeah. Good. Okay. Some of the medication that I've given you will help this. The gabapentin is going to help the nerve pain through that particular area. Don's also running with a range of infections at the moment. That's why she's also under immunology and infectious disease at the major hospital. So she's got the herpes zoster, which is the reactivated viral infection. Probably, I'll be saying we'll be running reactivations EBV, Epstein-Barr, and CMV cytomegalovirus quite commonly occur during this phase as well. We've got Klebsiella, hospital-grade infection. That's a multi-drug resistant biofilm protected UTI. It's a bit of a pain to get rid of. Second of the yawns, 603. So you're seeing a lot of predictability around these because we've done these so many times. We're coming up to almost the 1,000 mark over probably about 13 years. So we're very well experienced in doing this in a home environment. If this is you're feeling cold, no worries. Room temperature is 24.4. Going to turn the aircon off. It's a perfect room temperature. I'm just going to pass you your blankie. Third of the yawns, 6:04.
No.
Here we go. Where'd you go?
Yeah.
You're still here. Brilliant. It's very, very important with patients with 22q that the caregiver, either a parent, loved one, partner, is directly involved with the medical process, and particularly in the transition from adolescence into adulthood. They normally would need guardianship, particularly to cover and manage the medical side of things, the medical decisions, and particularly when there's communication deficits. Dyan's obviously got learning deficits, IDD as well, global developmental delays, autism, ADHD, OCD, Tourette's. How you feeling? You need to go to the toilet? Okay, just wait a couple of seconds because you're not standing on your feet yet. Okay. Dyan's also on frutamide at the moment, so it's going to be pushing through a lot of the fluid because she's running very high levels of full body edema. And you've had a bath, which helps to flush through. All of the lymph glands would have been activated as well. Yeah, you did. You had your pink fish in the bath, didn't you, for the first time? You loved that, didn't you? You had the clamshell. We had the fibre optic lights in there as well. We had some spa relaxation music playing on the iPad. Was that pretty cool? The ocean spa music was the best. Very nice. I'm just waiting for them. I know Dyan's asked for toilet, but at the moment she's not totally stable. I'm still seeing blepharism across the eyes, so there's some neurocognitive deficits here at the moment. I don't want her to trip, fall and have an accident. It's rather stabilising. So we're still seeing some post-seizure activity. It's a bit like earthquakes. You can have a build up to an earthquake, get to the main event, and then there's still some lesser events after the major event. It's the same concept for Dyan with her neurology. Hey Dyan, what day is it today?
It's Good Friday.
Good Friday, fantastic.
For Jesus.
Yeah. What do people give each other on the Easter Sunday as a gift?
Well, today we're supposed to eat fish.
Yep, perfect. Okay, so Dyan's got some recall and awearness of time and space and what to do.
Sunday.
So this is just a verbal sort of communication. Easter
eggs.
Sunday, Easter eggs, fantastic. Yeah,
We'll have to watch the sunrise.
we can
for
watch the
Jesus.
sunrise. Absolutely. Well, we watched the sunrise this morning. You're certainly up nice and early. Can you just drop your jaw for me, please? Good girl. Just on the right hand side, there's a slight ulceration. Sorry, left hand side mid cheek. No blood in the mouth. Sometimes with seizures, you can get obviously biting of the tongue, cheek, or lips.
I can't feel anything.
So you got numbness, and I'm not surprised because with the dystonia, you lose a lot of sensation build-up. I can see that there's some muscles still running and pursing into this right-hand side temporalis at the moment on the forehead. Yeah, your brow is thyroid. So do you feel any pain in your head? You need a facelift. Botox. Actually, Botox is used, believe it or not, for dystonia. Not that I'll be really keen to put botulism into you because the way your body will react to anything with mast cell activation syndrome.
No, thank you.
But that is one of the lines of defence for these sort of activities.
I had iron infusion at what happened.
Yes, you had an iron infusion and you had 18 seizures that day. That was a great day, wasn't it? Not.
Well, I nearly ended up in ICU.
You certainly did. Wasn't a good day at all. Just as you're putting around, I want to see what your blood pressure is like, miss. Oxygen stats are at 94, heart rate's at 58, is stable.
Makes me feel tired.
Yep, after the seizures, Dyan quite commonly will feel tired. We're getting a lot of yawns, which is also muscle relaxant. The clonazepam part of the medications are certainly going to help that, and that's what we want. That's why we give the clonazepam around this time.
I need to wee so bad.
Okay, well, very shortly I'm going to take you to do that. Very, very shortly, I promise you.
I was trying to watch something on TV.
You were trying to watch something on TV? Well, that's pretty cool.
No, this happened.
Oxygen stats seems stable. There's been a couple of little drop-offs and flapping around, but I think we're out of the woods with the yawning indicators. It has only been very, very rarely, maybe 3-4 times in the entirety, where after we've had a good succession of yawns, that there's been further seizures post that in a short space of time. So I feel quite confident confidence levels are high. Thanks for another sympathetic yawn. You're making me yawn now. You're probably making everybody out there yawn.
Sorry.
No, don't worry about that at all. That's all good. We're happy for yawns. Or at least I am, because it's an indication of relaxation. Max looks like he's yawning down here. He's tired as. Okay, so blood pressure has dropped down from the initial reading. It's now 93/55. Heart rate's up by 59, as you can see here. That's a good indication for Dyan that she's returning back to her baseline. Common tic action on the right arm. Dyan does have Tourette's, and in parallel with this condition, you can see things happen either simultaneously or surrounding it. So you might see in some of the earlier pre-ictal, just before seizure activities, Tourette's occurred, or myoclonus, restless legs. You might see them after, post the actual event, so in the post-ictal phase. So it's quite common for us to get Tourette's. Now that's also, Tourette's is a combination of physical motor tics plus vocal tics for a extended period of time. And obviously Dyan's had that for a long time in this combination, and she has some particularly common motor tics. Sometimes you might see the coprolalia come out with her Tourette's. That's where it's the inappropriate language, and copraxia, which is inappropriate indications, symbols, but that's actually not all that often.
People don't like that one, they judge.
Yeah, look, people shouldn't judge what they don't know, and if they haven't walked in your shoes. None of these things are in your control. It is a neurological misfiring, just as much as a meltdown is for an autistic. You have a lot of neurological things, a bit like your dysphagia. You can't control your swallowing, and that's why your dysphagia is occurring. You can't control your ataxia, that's why you walk funny, a bit like pinball bouncing off the walls.
To the
You are. You're going to see a neurophysiologist shortly.
He's going to help me.
Yeah, he's going to help improve the walking side of things. I'm just putting the midazolam away. We haven't had to engage in a stronger anti-seizure medication, which is great. Which is the whole point of the emergency med kit, is just to have everything out, ready and available in case things are necessary. I'm still waiting for stabilisation. I'm still just seeing some heart rate, oxygen and drops.
The plane's on the ocean. You missed it.
Did I miss some plane action? Goodness me.
The planes are the ones with the, they look like kayaks on the bottom.
Oh, so, okay, so they are the little single engine monoplanes with the floats. So they're float planes or seaplanes.
Yeah, I don't like them.
You don't like them because they land on the water. I reckon they're pretty cool. It's like a boat and a plane all at the same time. I'm pretty impressed.
But what if it breaks and then you go underwater?
Well, like Sharknado, when a shark leaps out and leaps and attacks the plane as it's taking off.
No, like the plane lands and the bottom doesn't work.
One of the pontoons falls off and breaks.
Go in the
Does actually happen, you know.
No.
Yeah, I didn't think you'd be terribly keen on that bit of news. Yeah, they are pretty clever, but you've got to be a good pilot to be able to land on water.
I do love planes.
You do love planes. That's one of your special interests as an autistic. So Dyan is autistic, ADHD and OCD as well as Tourette's. No, we're building it. We've got 3 planes for you now, haven't we? 2 Qantas and the other one's Singapore Airlines?
No, it's like
Oh, Lufthansa.
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 Jessica will have to help me pronounce
Yes,
it.
Jessica's one of our followers from Germany, and it is a German airline.
She's my friend.
She's your friend online, which is really cool. Got lots of lovely people who follow the channel and engage. That's just in Syncope at the moment. Just passing in and out. Oxygen stats are good at 96, heart rate's at 52. Current time is 6:12. Yeah, you're just a little bit wobbly at the moment. Discombobulated. Sweaty? Itchy? Where did you put that cloth? Let's have a look at the skin.
I had a bath. I had a detox.
You did have a detox.
Maybe the detox
Maybe.
was too much for my body.
Could be. And like I said, a lot of the time these things could engage the whole lymphatic system. It would have improved your circulation by being in there. So a nice warm bath with a spa would also get things moving around, and that could have
But I
tipped you
have
over
to,
between
'cause
orthostatic intolerance or
my-
your viral load.
I felt like someone tied lucky bands around my legs.
Okay.
It felt pain.
You were
Now
trying to describe it earlier today as if
It's
you're like a
like-
Barbie doll and your legs have been ripped off like a Barbie would. Well,
Yes.
not that you should rip off the legs off a Barbie doll, but that's the sort of
I
analogy. Okay. If the legs came out and you've got to pop them back in, you were
it was
saying that the
hard to
pain was
get them
around the
back
hips.
in.
But what I'm suggesting is that because of the edema and it's affecting your circulation and peripheral circulation, what goes to the fingertips and what goes to the tips of your toes, that's probably why you're feeling a lot of that pain. That's why we need to get the edema down, and that's what
It
the fruitiamide's
feels
been used for.
better
After the bath, baths are great. Baths are fantastic for circulation. They're great for cardiovascular. They're great to relax as well.
This guy's hurting.
Okay, so want to show? We've got some dystonic action, focal dystonia, still holding on the left hand. So with this, it is actually one of the things that you don't try and do is you don't try and open it up. So you're not trying to break the actual curvature because it can then cause an avulsion where the tendon comes away from the bone. What we want to do is a couple of things. We can try some traction below it. You can try hot-cold therapy, so putting an ice pack on or a heat pack. That will sometimes help as well.
Heat works for me.
Yep, well, I'm just giving you some traction. I'm actually putting the heat pack on, and we're going to bring the heat pack up
It's just really sore, like,
just into there.
yeah.
Yeah.
Yeah, exactly that.
Correct, right there.
How do you know?
Because they are the tendons that cause the flexion of those fingers, and that's why it's causing them to curl in on top of themselves.
That's
Also
the
part of
ones that have gone
dupuytren's.
hard.
Yep, so the hardening part is called dupuytren's,
What
or
does
they
it
used to call it
mean?
Viking's
Does
disease.
that mean it's gone calcified?
It's a bit like calcification, and it's a contracture which is where those ligaments or tendons are shortening and remaining in a contracted state and causing a lump to grow on top
I
of
need
it.
to go to a body shop.
You do need to
Not
go to a
the
body shop.
body shop.
But it's interesting they call it Viking's condition because I think
I come from Finland.
you do.
and
You have got
Holland
some in
and-
your DNA. I get that.
And
I think that's where the DNA parts of it
Germany
come from, actually.
and Iceland, and I have DNA, a
Yeah.
lot of it from there.
Some people ask me, obviously, my own medical knowledge and where I get that from. I do have a sports science degree. I'm used to actually working on sports injury rehabilitation and recovery. So a bit like a combination of physio and chiro in that sort of sense.
Keep going, because
Keep going, I get it. I'm so sorry.
It
So
hurts.
I've also worked as an ambulance volunteer many years ago. And of course, any caregiver, family member, patient who's
Even-
living with rare, complex conditions, you learn a lot about that condition. In fact, we've had to do a lot of research, haven't we?
Yeah, my tummy's even a bit sore from the heat. Hot
Okay.
bath.
Poor thing. It actually does meant to help the bowels, and it is good for your gastrointestinal system to have hot baths because it helps everything move. And particularly if you're a bedbound patient, having nice heat in a bath helps all those circulation factors. I know. Well, I'm glad that we stopped because one of my worst nightmares is if you're eating them and you go into a seizure, and then we have obviously choking and aspiration, and that can be very difficult. So I
That's
don't have a
why
suction device here.
I put one chip back in the packet.
Right. Well, you are very good
'Cause I
for
was-
knowing
Yeah.
that something was about to happen. I'm
Because
just going to wrap
remember
that around
last
for a moment.
time I had a
Yep.
focal aware and I had
Yep,
salad.
focal aware seizure, and we had to
in my
clear your
mouth.
whole mouth out and make sure nothing's going. So one of the things I might do or wish list will be to get a suction machine, and it's not so much it gets used all that often, but when you need it, if you know what I mean. Because sometimes then you've got to wait for an ambulance, and that can be a bit of a delay in
'cause
getting that.
In my salad, I have a lot of stuff.
You do have a lot of things. So we're very conscious and cautious around pre-indicators going into eating. So we are always checking, is she okay before we start the eating? And of course, if any symptoms change rapidly, as they can do with seizures and neurological, then we get her to stop, clear the palate out, and get ready for that. So that was very good. You were
I
able
put
to
the
tell me
chip-
that something was
I
not
put
feeling
the
quite
chip
right.
back in.
You did chip away. Now, with the neurology side of things, for patients with 22q, there is a lot of indicators. It's probably about 6.8% of patients with 22q will have epilepsy. It's higher than the normal average population precedence levels with that. Like I said, about 65% of them will have seizure and seizure-like type conditions. Those hypo or hyper states, but normally hypo more than calcium, magnesium. Those things will affect a lot of the patients. You've got hypocalcemia, that's why you've got the calcification built up in your brain.
Is that why?
Yep, so at some stage in your life, probably maybe earlier as a child, you would have had a lot of calcium related build up. You had calcium in your breast, you've got calcium in your leg,
Yes.
so you've got a lot of little pockets of calcium build up.
Why I had meltdowns and that's autism?
No, but it's the autism side of things. But what it would have helped with is movement. Chest pain, 619. I'm going to give you some nitrolingual spray. Heart rate is at 57. Oxygen stats are at 98.
Yeah, very good.
Open up. Hey Google,